the title of this presentation I called Medical School, the Good, the Bad, and the Ugly. Um, Last time I talked to your guys' group, I think it was 4 or 5 months ago now, we talked about, what it meant to be a DO and kind of, my process through getting into medical school and going through medical school. I kind of wanted to shed some light on my experience through the medical school process and, coming into the end of my residency, what I've kind of seen that people have struggled with and, what it's like to actually be a doctor. So basically the first thing is medical school right for me? And Raj and I were just talking about that. And that is probably like the most important question that you could ask yourself right now is whether this is, I think the biggest things to talk about is the reasons not to go to medical school. And, the first one is don't do it for the money, because I promise you it's not going to be worth it. There's a lot easier ways to make money, a lot faster ways to make money. And, without putting yourself in debt and without the time commitment. So, and then the second thing that I think is really important is that you don't want to chase someone else's dream. You want to go there because you want to go to medical school, not because your parents want you to go to medical school, not because, your friends are all going to medical school or that's the popular thing to do. And then lastly, don't do it for the status. Being a doctor is about taking care of patients and doing a good job and doing right by them, not to get a status, a title. There's other ways to be respected in your community without going through all that hassle. So I think most importantly is the reasons to go to medical school. And really the reason you should go is because you can't imagine doing anything else. Anything short of that, like you're going to have a lot of difficulty with, finding the motivation to make it through the really hard times. So, and then taking care of patients is your ultimate goal, and doing right by patients is really the things that let you sleep at night and what gets you through every day and getting through the tough board exams, the long nights in the ER, or even the long nights studying for your boards. And then really the ultimate thing, and I think this is one of the coolest things having been in the actual clinical side of medicine right now, is when you make a difference in someone's life, it's incredible. Like you see these beaten down people, someone that's just been in a terrible accident, that's a broken person, or someone that has been super disabled in their life, and you give them a second chance. You let them get up, they're walking with their grandkids again, they're out doing things to lead an active life, and that is just such a cool feeling. So what to consider when you're actually going to medical, or before going to medical school, is one, you have to realize that your social life is going to take a hit when you do. This is a sad fact, and everybody realizes it, but I don't think anybody realizes it to the extent that it actually happens until you've actually been there. And then the other thing is you have to be prepared to miss some important family functions, holidays, weddings, etc. And you're going to miss a few of them. You're going to be able to make some, but there will be a lot of social sacrifices you have that you're going to be required to miss in order to finish medical school and do well. And then one thing especially true in my residency and my career being in surgery, but certainly for everybody at some point, is you're going to lose a lot of sleep doing this. Even with the new rules and regulations, you're going to be up working or studying sometimes for over 24 hours without a break. It's just something that will always be there in medicine. The new rules allow you to work 24 hours of direct patient care, and then up to 4 additional hours is if you have a patient in critical condition that you can't leave. So that's looking at almost 28 hours before you can leave the hospital in some shifts. Fortunately, that doesn't happen terribly often, but it does happen, and it can be physically and emotionally draining on you. And I think this is really something that everyone needs to be prepared when they go to medical school, is that you'll face unfair criticisms and malignant personalities. And I think it's just because there's some very old school mentalities left in the profession, but I also think it's just medicine and surgery draw so many type A personalities that they really feel like they have to degrade people sometimes. I would tell you, don't let that get under your skin. Let it fall off your shoulders and keep going forward, because don't let someone else's negativity towards the profession or towards you or towards whatever their problem is determine what you want to do with your life. And then I think this has got a lot of press recently, but you will experience some self-doubt and what people know it as is imposter syndrome, where you don't really feel like you belong, or you feel like you aren't in the right place, or you don't belong in the hospital, etc. I think everyone to some extent goes through this, especially as a medical student. You can feel very undervalued at some points, where nurses don't respect you. But I will tell you that this does pass, and that as you get into residency and become more senior in your residency programs, you start to see the respect that you get as a physician, and nursing staff and other doctors start looking towards you for guidance. And that is a really cool experience and feeling. So I shared these quotes with you last time I talked, but I think they're so true. And I always say, you're not the only person crying yourself to sleep tonight. And people are always like, well, that's really cynical. And, once you get into medical school and you're studying for your boards or studying for your finals, you realize that, like, there's times where you're just like, I don't know how I'm going to make this. And realizing that there's 100 other people that are right there with you doing the same thing at the same time, really helped me get through that. And then I always say, people dumber than you have passed. So whenever you're thinking really low of yourself and feeling like you can't go any further, there's no way you're going to pass that final, just know that people that are in worse positions than you have done this and have made it through. Some common misconceptions I wanted to point out about medical school is that, one, I want to say my study techniques in undergrad will work fine for medical school. I think that your undergrad is very important for helping you develop the skills needed to succeed in medical school. However, you still have to adapt and learn different study techniques to adapt to the increased workflow and the increased volume of material. When you're an undergrad, you should really be focusing on, one, learning how to understand and comprehend the material and retain it. Begin to develop your skills from memorization early, learn to be an active learner, and then really figure out if you study better alone or in person, and figure out what your tactics are going to be when you get to medical school. And realize that just because they worked well in undergrad doesn't mean they're going to work well in medical school, and you may have to learn to use those skills and adapt them to the increased volume of material. So when you get into medical school, and Raj and I were just talking about this, you basically go to class, study, sleep, and then repeat. However, there's a lot of schools now that are changing their curriculums where you necessarily don't go to class, or you do go to class, or you have the choice of going to class, or it's online based. You have to find what system is going to work for you and adapt to it. Ultimately, it's all going to be the same. So starting medical school, the first month, you're like, holy cow, I upgraded from a garden hose to a fire hydrant. But it's pretty amazing when you realize that your body and your mind are capable of absorbing all that knowledge and retaining it in the long term. So the other misconception is that I can't have a social life in medical school. And I'm not going to lie, your social life will take a hit, and it'll take a big hit once you start first and second year. There's no question about it. You'll develop new friend circles. Your friend circles will be people that are in your situation, and you'll find time to have fun and to relax and kind of develop those social contacts. But I really encourage you to continue to find your interests outside of medicine, and it'll help you prevent burnout. So it is possible to have a social life in medical school, but it takes some work, and it's really important to maintain. So the other thing that I wanted to touch on in this is that I won't have time for a family in medical school. That's false, kind of. It is very possible to maintain a healthy relationship. I think it's really important that you and your partner, whether it be a spouse, a significant other, a wife, a husband, etc., it's really important to have that conversation up front with that person, and that you both are very realistic on what the sacrifices are going to be. I have gone days without seeing my wife before because of the rotations I've been on, or my call schedule and her call schedule. Family holidays become very hard, especially when you get into residency and you become on call. And there's just situations that no matter how important the event, sometimes like you can't leave the hospital. There are exceptions to that, but it's just something that you have to be really honest with whoever your partner is, and that they understand that this is a significant part of your life and takes a lot of dedication to get through. First, I just want to say, just take a deep breath. It's going to be okay. It's not all doom and gloom, and most often you will be fine. You can get through this. It's important to know the compromises and the risks going into it, but realize that people have made it through. I made it through, and you just have to be aware of what you're getting yourself into mostly. So great things never come from comfort zones. Medicine is the ultimate test of getting your comfort zone pushed out into limits you never thought it would make before. So, and then the last thing you guys had mentioned was talking about burnout. This is a super hot topic in the press right now. Burnout is a real thing. We see it all the time in all different specialties. So basically, what is it? And the American Medical Association says that burnout is a long-term stress reaction caused by depersonalization, including cynical or negative attitudes towards patients, emotional exhaustion, a feeling of decreased personal achievement, and a loss of empathy for patients. Unfortunately, I have to say this is true. I've seen it in my specialty. I've seen it in other specialties. Basically, what it means is the clinical system has gotten so big and so robust, and the outside pressures outside of patient care is gotten so large that it's affected physicians' ability to care for patients. So one of the things is, what is it? It's, like I just said, it's a lack of control over your work conditions, time pressure, chaotic workplaces, lack of alignment values around purpose and compensation, and disagreement between them and their leaders. So this goes beyond just when you're an attending. This happens when you're a medical student as well. So symptoms of medical student burnout are exhaustion, emotional detachment, feeling incompetent or useless, or the imposter syndrome, or feeling of alienation. I think the important thing to realize with burnout is, first, realize that it can happen to you and don't ignore it. If you are feeling signs of burnout, you reach out to your classmates, your faculty, your university, and there are beginning to become mechanisms in place for the schools to work with you to get you through that. So find your friends in your support network. Your friends, family, and coworkers and peers can be great resources to help you with burnout and keep you motivated to continue on your course. one thing that I see this constantly in residency is we are really terrible about blowing off physician and resident and student wellness programs. Those are being put in place by the American Medical Association to help prevent burnout and get us through this and keep our mental wellness up. And then really remember why you wanted to be a doctor. That can be extremely motivating. And then once you get out into clinical practice and you start getting patients that you've actually helped and you see how much impact you can have on someone's life, that becomes a really big driving force. And don't give up on your passions outside of medicine. This requires a lot of sacrifices to get to where we are, but you have to keep some stuff for yourself and continue to be a person outside of just being a practitioner. You know, one of my attendings or clinical faculty when I was in medical school said, medicine is a dirty mistress. And I thought it was kind of funny at first, but then you realize that if you let it, medicine can steal your time, it'll steal your family and take over your life. I think that's one really cool thing about our generation of doctors and your generation of doctors is that I think we're not willing to sacrifice this as much. So I think that we're really pushing to make this a better living environment than it was 10 years ago. And then just take care of yourself mentally and physically. And then just remember that the struggle you're in today is developing the strength you'll need for tomorrow. I think the hardest thing about being a medical student for me was studying as constant and unrelenting for the first 2 years. Overall, prepping for step 1 of your USMLE and COMLEX is the most stressful, and a close second is matching into residency. And then how to survive and find a balance. Like we've talked about, develop a support network. Don't forget to have fun. And if you have a hobby that makes you happy, stick with it. And then I love this book. This is 7 Habits of Highly Effective People by Stephen Covey. And he says, just remember, never be too busy to take time to sharpen the saw. And that's in reference to take care of your own body and your mind so it can support you along your journey. So really, anybody can do this. Be dedicated enough to overcome the obstacles, and it will go faster than you think. And then once you get to on my side of it, and I'm looking at graduating next June and being done with residency, you look back and kind of in disbelief that, you know, the journey is actually kind of winding down and that there's actually a light at the end of the tunnel. And it's just a really cool experience. And, you know, I encourage everybody that I can to go down this path. But, you know, you just have to make sure it's the right one for you.